بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Professor Dr. Ayman Abdulhamid Nagy again with you with this lecture. Is very interesting and lecture of medical ethics أخلاقيات المهنة باللغة العربية. This is not a physical lecture. Medical ethics, basic concepts of medical ethics. Medical ethics, basic concepts of the medical. From the medical ethics, and this is a very important point. You should know your patient and his intelligence, and also speak in his language. For example, this doctor is saying for the patient, do exercise daily for good health. The boy say, sir, I play football, cricket, tennis daily. Doctor, how long do you play? Boy, until battery in my mobile goes down. He didn't understand the doctor, and the doctor should speak with him. Medical ethics. The medical professionals established according to the law 624/1949. It is in Egypt, including the list of literatures and the code of ethics of the medical profession, which have been modified by Ministry of Health Law number 234 for 1974, then amended by the Ministry of Health and Population number 338 for 2003, dated 9 of May 2003. Why there is a law and medical ethics for this profession? As this is very important. If you said that the engineer person is very important profession, yes, he is a very important, but I am an engineer of the body of creature of Allah, human being. This is a very important, and all the universe work for this human being. The objective of our lecture, there is some with a red line and some with dark black line. The red line, this is just extension, and you should read as this is what is your role as a physician and duties to the community, and the doctor and their profession, and the doctor towards the patients, towards their colleagues. But I made it as an extension to decrease the lectures somehow for you and for the exam. These 4 objectives just for reading, not for the exam. Duties doctor in a case of special nature of the medical intervention. Duties of the doctor in conducting experiments and medical research on human, and the consent and patient secrets, medical consent, medical type, and medical and its types. Here for reading, all things you should be purely pleasure for Allah and community service. A physician should a good example in the community. For your profession, should a medical report testify in away from specialization and contrary to reality, not to do away from your specialty. A doctor may not work comes from the following acts: the use of intermedia to allow exploration his names in promotion drugs, to share his rewards with any of, and I but please this or three and your profession. The duties of of a doctor with special cases of medical. These are for reading. Please. Subjects subjecting assisted reproduction. People usually seeking the fertilization, and some people is infertile. Assist fertilization object operations subject to the wife of oocyte to sperm of the husband inside or outside the wife of ethical control. But husband and wife in the married stage, not divorced, not from the dead husband, aimed at preservation of the human birth control and infertility treatment, with emphasis on the purity of lineage and legal standard issue. No one may make fertilization assistant operation within the body of the wife beyond using her husband's sperm in a case that the marital relationship between them legitimacy and may not transfer to fertilized ovum implanted in the wombs of the woman who are not the mother mean rent uterus. This is not. No banks be established for eggs or sperms or embryoes. Don't be authorized to exercise assisted production operation only in centers equipped and authorized to exercise this operation. Your center to do this should be equipped by all instruments needed and authorized to exercise this operation. Necessary to keep a detailed record for at least 2 years. Needs to be the life contains the contract and the recognition of, but please read it carefully, and it is very important for Doctor can do testing or medical research to the human. Yes, he can do, but under control and restrictions and law. Doctor most committed to the implementations of the all ethics standard and to controls social and religious value by authorized to conduct medical research. It is prohibited and no doctor allowed to make tests for drug and techniques of human before approval by competent authorities. Before conducting any search for human, the doctor should be committed must have a thorough study on the risks and burdens to which individual or groups to compare benefits. The benefits expected to be obtained from research. The search is limited academically qualified specialists to conduct research under a direct supervision of a doctor of a high degree of efficacy and specialization. The responsibility of health protection for volunteers, responsibility of the doctor supervisor. Defines the volunteer's folly. Committed research defines the volunteer's folly by clear objective research methods. Benefits expected, risks and the possibility of their impact on volunteers. Should know the sources of the funding of the research, the identity of the researcher in charge of an institutional affiliation, reaffirm the rights of volunteers to stop the volunteering for tests to or completely withdraw from research without causing him any negative consequence as a result of stopping or returning. I mean, don't threaten him that if you stop this, the volunteering of the test, I'll punish you, I'll complain you to the police, you will not be treated in the hospital of our countries, I'll get the money again from you, and the money not allowed also in this research. It should be volunteer. For eating and for how he will come to your research center, taxi or something. The physician researcher obligated to obtain written consent based on the knowledge in the presence of witness. This is a type of consent, written and witness prove the case. Researcher committed to prepare a report online detailed and clear about objective of the research and justifications made on the human and submit to the competent authorities. And this report should be continual and continuous with the previous one, not interrupted report. Measures to be taken before or after conducting research. The researcher committed to immediately cases completely on any experiments on a human, as it has shown to outweigh the risk associated with the adverse effects. I started research, but has a risks more than benefits. I don't suspect this risks. Stop. A researcher is committed to ensuring the availability of all preventive, diagnostic, therapeutic methods for each patient to conduct study. It is prohibited the researcher conducting research and practice involving liquid mixing of leanings or cloning. No cloning is allowed. Don't change the human creatures and the human being. Take the pledge required for a donor. Doctor is obligated to provide medicine that's being tested on the patient and proven effectiveness to the end of treatment program without this is a joke, but it's true. Don't give false concepts for the patient. For example, this patient asks the doctor, is there any medicine for long life? Doctor, get married. Man, will it help? The doctor, no, but it will avoid such thoughts. You are give him a falsificated thoughts and false thoughts. This is not accepted even with a joke. Here, the doctor doing research by fixing the rib or broken rib by Photoshop. I know this is joke. Medical facades and legitimacy of ethics and practice condition terms participating medicine. It is regulated by 142 of 1948 terms participating medicine. No graduated may be in holds of Bachelor of Medicine from the university approved and recognized practicing medicine in public capacity whatsoever or private unless the Egyptian nationality was from a country or from a country allow its law to Egyptians practicing medicine out after extraction practice permission from the Ministry of Health and Population registered his names in syndicated doctors and pay monthly subscription or syndicated shall be punished by imprisonment not exceeding 2 years. This is an old law from 48, or fine not exceeding £200, one of the two penalties or of each practicing medicine on the face of the country law, or in a case of return to the two punishment, imprisonment and fine. Three errors, the error medical errors can be divided into three sections: grave error, fatal, and inadvertent. Grave as a result of ignorance of things. I need to know every doctor and punishable by severe criminal courts. Mean the doctor doing his best, not doing his best, and ignorance of small things or large things of the surgery, for example. All doctors of in the same specialty and the same level of education know these basics. Fatal error due to negligence or lack care or caution or ill treatment, neglect business, and the lack of medical methods non-followers. For example, doctor did an operation for the patient and went for vacation outside the country, and he doesn't follow the patient, doesn't even not give an instructions for other doctors, assistant doctors to and call to do and call him in there is danger. This is a fatal wound. Adventure or an experiment or research on sick people without permission, without the other condition I said before. Some courts have held error needs to be a technical error purely and become a doctor in charge of him because he didn't follow the well-known technical rules that don't otherwise and which not unknown to any doctor no matter. Should be a medical error, not by not going to the court and saying the doctor and insult me and doesn't deal with me. This is not a medical error. This is another. There is another law for laws for this complaint. Discriminate the doctor is responsible civilizations as occurred permanent disability as a result of ill treatment. So even he follow all instruction, but there is a permanent disability. This is an error. Responsibility of the surgeon. The surgeon not initiate any process only after taking the patient consent or from the guardian if the patient is minor. The surgeon during operation is responsible for the work of his aides and nurses who work under his supervision. Mean the surgeon is the maestro of the surgical room. He forget here the scissor clamp. Okay, well, who is responsible? The doctor or the nurse? If the doctor asked the nurse before, the assistant nurse, before starting the operation, how many scissors and how many needles and how many goes bees and how many come with you, she said, for example, 30. And after the operation, count your instruments and said, okay, doctor, it is 30. The responsible is the nurse. But if he didn't ask, the surgeon is the responsible one. And this is so we saying the maestro of the surgical, the surgeon is the maestro of the surgical room. But this condition need witness of other nurses, the anesthesia doctor, and asking they will be asked to testimony for the confidentiality of the birth, confidential birth. Read and understand well. and your profession. Declaration of Geneva, 1948, respect secrets even after the patient. Also, the International Code for Medical Ethics, amended in Venice in 1983, also saying this. This is a confidentiality, the patient secret. His home, his personal, how many kids, all of these are confidential secrets. WHO guide insists also medical intervention should be carried out only when the proper respect shown to the privacy of the patient. This means that the only person who may be present when intervention is carried out are persons who are necessary for the interventions, unless the patient consents or require otherwise. Patients admitted to the healthcare institutions have a right to expect physical facilities which ensure privacy. But don't examine any patient without a nurse with you. This is a medical assessment. There is a privileged communication. This privileged communication can be breached. Yes. For the interest of the patient. Referral to the health personnel, for example, the doctor tells his assessment about the clinical management. Parents and guardians, the patient minor, the patient psychotherapy, psychopathic, the patient refuses to carry out treatment in suicidal tendency. So it isn't for the interest of the patient. Breach the confidentiality of the personnel. For the interest of the patient family, the second parity for communicable it should be warned about AIDS or HIV from her husband or from his wife. Communicable disease, he has a corona, for example, and you should be do this and this and so. For statutory law and laid down by the law, for statutory duty laid down by the law, registration of the births and stillbirths and deaths, notification of infectious diseases and industrial diseases to the specific committee, public health law, poisonous and factors, therapeutic abortion, drug addicts. This is laid down by the law. Medical intervention should be carried out only when the proper respect shown to the privacy of the patient. This means that the only person who may be present when intervention is carried out are persons who are necessary for the interventions, unless the patient consents or require otherwise. Patients admitted to the healthcare institutions have a right to expect physical facilities which ensure privacy. But don't examine any patient without a nurse with you. This is a medical assistant. these lectures, these slides. Okay, what's about all matters voiced in the court? It are absolutely privileged and carry no risk subsequent action on definition of breach confidence. The responsibility of judge. Report sent to the court or a court order also absolutely privileged. Statements made to state prosecutors and the crime investigators also absolutely privileged. A report given to rival party or third party without the consent of the patient amounts to breach confidence. Disclosure of the patient secrets for your self-interest. When the doctor's own integrity is threatened in civil and criminal action against the doctor, by the patient, a doctor can defend himself by giving evidence about the patient illness without going to the past history or family history or other history. For example, the patient complained from you didn't give him prescribed antibiotic for him, and so he was diseased and absent from the work. Okay, you will defend yourself. He has a viral infection, he doesn't need antibiotics. For self-interest, for medical teaching and research and audit under restrictions, I said before. I showed you in the lecture of complications of wounds or cause of death from the wounds. A lot of pictures. I didn't report a case without relieving I can report a case. I reported the case without relieving the patient's identity or his country. Okay. You show that only for medical teaching, and this the faculty of medicine is for teaching and treating. The confidentiality of the confidential personal health information. What you know from the past visits of this patient to your clinic, you didn't tell this for the insurance. In medical practice, it refers to the willingness of the person to subject himself for examination, investigation, and treatment. This is the willing of the patient. Of the patient in the medical practice. There is a condition for the consent to be valid when it's free and voluntary without undue influence given by competent person is informed information necessary to make therapeutic decision, relevant information about the research, relevant medical legal should be taken from the spouse, especially when it affects the reproductive or sexual function permanently. I mean, one female came to your clinic to do permanent infertility. You should tell her husband and get his consent. May be given by and the consent may be given by a guardian or proxy consent in a case of mentally retarded or minor, or patient cannot give consent by himself, for example in coma. Types of consent: expressed or implied. Implied mean when came to your clinic voluntary and paid fees for you to be examined. This is just for inspection, palpation, percussion, auscultation. If you need another or further medical intervention, should be expressed. Expressed consent mean verbal or written. This is the subtypes, or gesture or written and witnessed. Gesture not be accepted in the medical world, as you didn't know if the patient making his head up and down, maybe he has a headache, maybe he has tired from his neck, maybe he refused or accept. If he is running from the clinic, from the hospital, running away, you didn't say he refused the operation, maybe running for something else, so gesture is not accepted. This is types of consent. Implied, I said before, person voluntary comes to your OPD or clinic, he gets admitted to a ward. Person who comes voluntary for examination for insurance company, however his consent is limited to ordinary forms of examination, investigation techniques needs expressed consent. The doctor gets valid consent from a competent patient after explaining, and he is going to do the implications of what is to be done. In other words, the patient must express his willing for examination, investigation, treatment obtained by in the presence of a third party. It's expressed and with for eating and for how he will come to your search center, taxi or something. The physician researcher obligated to obtain written consent based on the knowledge in the presence of witness. This is a type of consent, written and witness prove the case. Researcher committed to prepare a report online detailed and clear about objective of the research and justifications made on the human and submit to the competent authorities. And this report should be continual and I said expressed or written witnessed consent should be taken in these conditions before invasive examination and treatment. For example, per vaginal examination or rectal examination, taking blood for investigation, intravenous therapy, chemotherapy, radiotherapy, surgery or any procedures need anesthesia, experimental medicine and clinical trials should get expressed, written or written and witnessed. Should be written and witnessed, and some need written only and other need written and consent. For example, experimental medicine and surgery or any procedure needing there is a condition for the consent to be valid when it's free and voluntary without undue influence, given by competent person, is informed information necessary to make therapeutic decision, relevant information about the research, relevant medical legal information. can I get consent from others, not from the patient? Minor. Incapable of giving valid consent, for example, coma. Where there is no such parent or guardian, court order may be obtained. No examination can be carried out at the request of the police officer or employer without consent. In a case of school children in state of school, even though the consent of the parents is not required, the objections of the parent is upheld on the condition that they arrange their own general practitioner to conduct an examination. For example, I sent my baby to special school. This is an implied consent from me. The general practitioner and the school can examine him, measuring the temperature, and give him some antibiotic for treatment for his fever. But if I sent paper for the school, please no examination by your general practitioner doctor for my baby. So the school hold the implied consent. Okay, one kid fall down from the stairs and his leg was broken. The general practitioner of the school take him to the hospital. They wanted to give general anesthesia to fix the fracture. They should send for the father first or a guardian to get the consent. But he can give analgesia for the baby to avoid shock from the pain from broken leg. Fix externally until father come and doing the operation after. Consent for procedure involving marital rights such as sterilization, termination of pregnancy. The consent of the spouse is obtained to preserve the family harmony, even though it is not legally required if it is emergency and saving the life of the spouse. Okay? Of the wife. If the procedure is carried out to save the life or preserve the health spouse, there is absolutely no need for his consent. Okay, I can get the type of consent, can get consent from others. Yes, I didn't need consent at all. Yes, in a case of emergency, but put right beside the emergency, saving a life of the patient. Saving a life of the patient. Mandatory vaccine requirement, for example, poliomyelitis, no need for the consent. But the father and the parents will be punished by the law if they refused. But influenza vaccine, it is not a mandatory vaccine. Need consent first before giving vaccine. A status required quarantine in a case of contagious disease. For example, coming from the airport and measuring temperature, it is high. They took you to quarantine. This is not. They suspect corona virus, so need no consent. Examination under court order, this not need a consent. But examination under police order need consent. But examination under the director or the head of the job of his job need an consent. This is brainstorming. What is this? This is an apple. Some saying, oh, it is delicious and I am so hungry. I need to buy apples. Oh, I need an iPhone, mobile. Other, this is there is a condition for the consent to be